Hi, this is Nilanjana here coming to you with a video on migraines. Now we have made the term migraine very common. So if I have a headache, I call it migraine. If I have a slight runny nose, I say I have the flu. Many things like that. The word has just been loosely used for so long that we've forgotten what it originally meant and how serious it can be. So a migraine headache is usually over half the head. So you can either have the left side of the head or the right side of the head that is involved. It usually has an aura, not usually, but most times it can have an aura. So what is aura? Aura is, say for example, some people will get flashing lights, or some people might get a little bit of dizziness. This happens just before the headache starts, so the patient knows that the headache is about to start. This is very typical of migraine. In a normal headache, there is never any aura, never any sort of warning that the headache is about to start. So if you have an aura, you're very likely that you have a migraine and not a usual headache. The other thing about migraine is that food triggers like cheese, chocolate, coffee, red wine. People might have other food triggers too, but these are the common ones. So you are getting a headache on half your head, and you might get a bit of a warning, and you might have some food triggers. What's the other thing about migraines that makes it so dangerous? Migraine is basically a throbbing of the blood vessels inside the head. So the blood vessels inside the head are pulsating and throbbing, and that gives you the pain. The problem here lies in the fact that if you had, just for discussion's sake, any blood clots wandering about, then those blood clots will get dislodged and they are going to sit down in one of the blood vessels and give you a stroke. So same as the blood vessels, if they're blocked in the heart, give you a heart attack. Blood vessels blocked in the head give you a stroke. So say for example, if the patient is on the combined pill, it's a woman on a combined pill, the combined pill tends to thicken the blood. So anybody who has even a very slight chance of having a migraine, we will not give them the combined pill, not give them any estrogen, because estrogen will thicken the blood in the premenopausal state, in the reproductive age group, and this leads to a higher chance of clots in the body. So that is the first thing we need to do. Just make sure the patient is not taking any estrogen, and we need to get some imaging of the head done to make sure there's nothing sort of structurally or organically wrong inside the head. Make sure that's out of the way. We need to do some blood work to make sure all the baseline is good. I will also ask for a food diary to find out if there are any food triggers, and we'll ask the patient about aura. We also ask the patient about whether she needs new glasses, if she does wear glasses, or to have her eyes checked if she hasn't had an eye test in the last 1 year. So these are all the important points to look at when we are considering migraines. Fortunately, there are plenty of medication for migraines available and newer therapies coming out all the time. If you have any further questions, please ask and I'll be happy to answer them.